Hello, this is Dr. Ashok, sexologist from International Center of Sexology Research and Development, Hanuman Junction, Krishna District, Andhra Pradesh. Let me explain you today about sexual pleasure, sexual arousal, and about foreplay. Like all skills, having good sex needs to be worked at. It is not something that we instinctively know how to do well. Rather, it needs to be learned, and, like most things in life, it usually improves with practice. Nor is it enough to simply understand how the body works because there is no universal recipe for sexual pleasure and satisfaction. Everyone has their own individual preferences and their own unique physical likes and dislikes. Finding out about each other's sexual needs is part and parcel of having a sexual relationship. An important part of this involves understanding and discovering how your own body is best stimulated and sharing those discoveries with your partner. Despite these personal differences in sexual likes and dislikes, the sexual response itself follows the same stages: arousal, leading on to orgasm, and finally resolution in every individual alike. Let's see what is sexual arousal now. If a couple having sexual desires and are attracted to each other, they may find that they want to take things further and enjoy each other sexually. The first part of sexual pleasure is arousal, when each partner becomes sexually excited. Arousal can result from the sight or smell of a partner, through thoughts about sex, or through the direct physical stimulation of foreplay. Women usually become aroused more slowly than men during foreplay. Men are aroused relatively quickly, often becoming excited initially by visual stimuli such as sexy clothing or the naked body. As arousal progresses, a plateau stage is reached, during which a high level of sexual tension is maintained. The penis and the vaginal lips become engorged with blood and darken in color, and individuals tend to focus on sex and their partner and ignore everything else that is going on around them. If sexual interest is maintained and if sexual stimulation continues, a point is usually reached where sexual tension peaks and orgasm occurs. Now let's check with foreplay. Foreplay is the prelude to love making, whether that goes on to involve sexual intercourse or other forms of sexual activity. During foreplay, partners stimulate each other in as sensual a way as possible to the point where they both become fully aroused and are ready for intercourse and or for orgasm. Foreplay can involve just about anything that both lovers find enjoyable: kissing, caressing, stroking, or licking any part of the body. It often starts with non genital touching and culminates in direct stimulation of the most responsive erogenous zones, notably the penis, clitoris, and the breasts. Thank you. Your Dr. Ashok.